As we move forward through this public health crisis, there seem to be two competing impulses that people have in their head right now, understandably. One is that we listen to experts, that coronavirus is more serious than the flu. So you want to take it seriously. If you contract it, you definitely want to stay away from other people. But the other impulse is just that, people get colds, they get sick, they get the flu. So what do you do if you are symptomatic? What should you do if you're feeling ill? To answer that question, I brought an emergency medicine specialist, Dr. Reed Caldwell, assistant professor, emergency medicine at NYU Langone Health. It's great to have you here.
Thanks for having me.
All right. So this happened to me the other day, someone that I love. I came home, that person said, I feel I have a bug coming on. And there's that kind of terror moment, like, uh-oh. A lot of people are going to feel that. What do you do if you have symptoms?
Well, as has been discussed, first, the most important thing is prevention. So we know that this is a virus that's spread by droplets, which means coughing and sneezing. So anyone who's coughing and sneezing should be sure to cover their face and should have prompt hand cleansing. We've talked a lot about, as everyone's been talking a lot about, social distancing and self-quarantine. So those are really imperative preventative measures.
Okay, but if I have a fever and I have a cold and I feel like I have a flu-like symptoms, which is going to happen to a lot of people, what do you want me to do as a person who runs an emergency room?
Right. So what I want you to do first is distance yourself from those people that are well, particularly people that are immunocompromised and the people at extremes of ages. We know that our elderly population is at most risk, and it's up to all of us to help to protect those people. Secondly, it's important to maintain good health habits, good sleep, good hydration, taking ibuprofen or Tylenol for fever, and really working to manage your symptoms and make yourself feel better.
Okay, so let's say I feel sick. I go way down to the basement of my house. We separate from the rest of the family and other people, and I'm down there, and I'm still feeling sick. Do you want me to call my primary care physician? Do you want, and how do I know when it's time to go to the ER if I start to feel really bad?
Right. So as was mentioned earlier, we're all keeping an eye on the overall capacity of the healthcare system, both locally and in the United States. So it's going to be really important that everyone works to match their level of symptoms with their level of care. So, for example, people who are well or have very mild symptoms, it's going to be really important to go to sites like the local health department or the CDC to understand what's going on with you and how you can
care for yourself.
The websites, yep. And then for people with more moderate symptoms, it's important to utilize some telehealth platforms or telephonic platforms to be able to continue to self-isolate, but to seek evaluation and consult. And then certainly for people with severe symptoms like respiratory distress, those are the people that we really need to have using the 911 system and the emergency system.
Okay, so what I'm hearing from you is it's very important to keep people that don't need emergency care out of your ER. Is that a fair thing to say?
That will allow us to take the best care of the sickest people.
Okay. So if I'm 30 years old and I've got a fever and flu-like symptoms and I'm holed up in my apartment, I'm drinking a lot of fluids, I'm taking ibuprofen, what you're saying is stay there, stay away from people, and maybe check in with your doctor through telehealth if you can.
That's right. Just like you would if you had influenza or if you had a bad cold.
When you say respiratory distress, I know we're trying to do sort of diagnosis at scale here, so I understand that these are hypotheticals. But if I'm 68 or 70 and the same thing happens, and then I start to feel a really persistent dry cough, for instance, what's that line there about respiratory distress?
So certainly the more medical problems you have, the existing medical problems you have, and the older you are. So you mentioned 68, 70 years old. Particularly if you have diabetes or cancer, otherwise immunocompromised, it's important to seek care a little sooner when you're having maybe fever, cough.
And presumably those people have points of care before they get to the ER, right? So I mean, where you want to be directing people to should they be talking to their personal physician and folks like that?
If they're able to, yes.
Right, but of course, if people are in urgent distress, they need to call 911 and go to the ER.
That's right.
What is your capacity looking like right now as a doctor running a very large and important ER here in New York City, which is rapidly expanding the number of cases?
Because of the way this really ballooned in China, we did have some warnings. So we've been working for quite some time, weeks, maybe more, definitely more than a month, to rapidly expand care and really scale up how we take care of patients and our capacity. So we've been working hard to prepare. We're ready.
All right. Dr. Reed Caldwell, that was very informative, and thank you very much.
Thanks for having me.